Hi, my name is Carrie Holleran, co-chair for the Knowledge Translation Task Force for the Locomotor Training CPG for the Academy of Neurologic Physical Therapy. I would like to discuss the Intensity Matters National Campaign with a special focus on safety considerations when implementing high-intensity activity in your clinical practice. First, I'd like to introduce the KT Task Force. We are a group of clinicians, academicians, and researchers from across the country. Our task force was given the important task of developing and driving the national campaign. So I'd like to address our disclosures. The Knowledge Translation Task Force for the Locomotor Training CPG has no disclosures to report. The goal of our task force, among many, is to provide practice tools to enhance translation of evidence into the clinical environment. The task force does not endorse the purchase of specific products. As part of the 2018 strategic initiatives of the ANPT Board of Directors, Core Strategy 1 focused on the translation of evidence into practice to ensure high-value care with input from practitioners to inform future research. The development of a national campaign was at the forefront of this effort to push forth a high-quality piece of evidence to membership. This is where the Intensity Matters campaign originated. In an effort to increase awareness and translation of research into practice, the ANPT has selected a high-impact area of evidence to promote at the national level. The campaign, Intensity Matters, is focused on promoting walking training at high cardiovascular intensities to maximize locomotor outcomes for individuals with neurologic diagnoses. Improving walking function is a common goal for individuals after neurologic injury. Several key components that promote neuroplasticity include repetition, task specificity, and intensity. While repetition and task specificity often play a predominant role in walking training, there has been less of a focus on defining intensity during these interventions. Recent research supports walking training at high cardiovascular intensities to improve walking-related outcomes and is therefore the focus of this national campaign. In order to implement, however, high-intensity training, careful consideration must be dedicated to ensuring patient safety. Continuous heart rate monitoring is essential to ensure safety while implementing this training. Therefore, a heavy focus of the national campaign is developing tools, educational materials, and supports to clinicians in delivering this intervention safely. Please refer to our Intensity Matters webpage for a variety of tools. Unfortunately, data demonstrates that vital sign monitoring is not a part of routine practice. Further, data demonstrates the effectiveness in outcomes when vitals are monitored across a variety of practice settings. We must do better as a profession in screening vitals and for appropriately assessing them to gauge the response of individuals during our interventions. Another focus of the national campaign is to improve implementation of high-intensity gait training into the clinical environment, when improvement of walking outcomes is a primary goal. Remember that although we will provide resources for safety guidelines, physician guidelines always supersede any published values. When there is any concern of an individual's ability to participate safely in high-intensity gait training, ensure that there is communication with physicians. When in doubt, check it out. Further, we have provided a letter to physicians to gain medical clearance, highlighting the most up-to-date information on high-intensity gait training. And remember, in the absence of specific physician recommendations, to always follow published safety guidelines from ACSM, AHA, and ADA to ensure safety at both baseline and during activity. We have provided a vital sign parameter document that you may print out and post in your clinical environment that summarizes the most up-to-date guidelines from each of these entities. When implementing high-intensity gait training for the first time with any patient, you always have the option to systematically progress an individual into an intensive training zone. Perhaps you have a cause for concern and want to monitor their response to increasing heart rate ranges. Perhaps you have a patient that simply cannot tolerate the intensive training zone. That is okay. Don't give up. And remember, communicate closely with your physician along the progressive levels of intensity if there is any cause for concern. Lastly, Delivering high-intensity gait training is expert practice. It requires the skill, assessment, and knowledge that the unique body of knowledge of the profession of physical therapy has to offer. When working with your patients, you are continuously drawing on the triangulation of a multitude of sources of data. You will want to monitor the objective outputs such as heart rate, blood pressure, blood glucose, oxygen saturation. You'll want to assess patients' subjective report of exertion and symptoms. And you will utilize your visual appraisal skills to monitor how the patient looks or is breathing, among many. Triangulating these sources of data is incredibly important to ensure our patients are safe during high-intensity gait training. Thank you for your time, and remember, intensity matters.